Why do you specialize in hip, shoulders, and knee?
All the medical specialties, if you see, they have sub-specialized into small niche segments. What I do is arthroscopies of the knee, hip, and shoulder, and I do replacements of the hip, knee, and shoulders. Instead of total knee replacements, there's an advanced surgery which I've been doing since the last 15 years. That is partial knee replacements. Unfortunately, not many patients are aware about this surgery. The world, there would be about 25% of surgeons who are doing a partial knee replacement surgery. So the awareness is not there.
How exactly the life looks like after the surgery?
So the knee surgery, whether it's a full knee replacement or a partial knee replacement, most of the patients are quite comfortable in the evening after surgery. So our protocol is that we make the patient walk in the evening. So the surgery is done in the morning. Within about 8 hours, the patient starts walking. And is discharged the next morning.
If you have seen the very famous movie Munna Bhai MBBS,
That's right.
whereby Dr. Asthana, the role character was played by Dr. Boman Irani.
Yes.
He says that you cannot show compassion towards patient because if you do so, that on the surgery bed, your hands would shake, it would tremble.
Yes.
So how right is it, or you did it in some other way?
So it is whatever surgeries that I do, they are all elective surgeries. Any person is free not to get those surgeries done or can live with that pain. So in the last 2 decades of my practice, I have never ever forced a patient, coaxed a patient to get a surgery done.
Any patient who has undergo even the primary surgery, can they live a very normal life, or is it like something that would be restricted?
So as far as sports injuries are concerned, most of my patients go back to playing sports, even recreational as well as professional. We've had badminton players, footballers who've gone back to playing their sports after shoulder and knee surgeries.
What are usual symptoms that one should focus on before actually visiting a doctor or a consultant?
So I would say it's the worst thing to visit doctors. Oh,
I was saying,
oh yes, anosognosia. Okay, so I tell my patients, I think going to the doctors is the worst thing ever.
हेलो एवरीवन, वेलकम टू द बिस पॉडकास्ट। आज के हमारे गेस्ट है डॉक्टर अमीन रजानी एंड आई एम एट हिज क्लिनिक। आज का पॉडकास्ट बहुत ज़्यादा यूनिक है, बहुत इंटरेस्टिंग होने वाला है एंड आई अश्योर यू दैट बहुत न्यू चीज़ आप जो है वो सीखने वाले हो। डॉक्टर अमीन, थैंक यू सो मच। हाउ आर यू?
I'm good. Thank you so much, Shaz.
Okay, so Dr. Amin, I was trying to get in touch with you. I wanted to have you on board, and I wanted कि मैं अपने guest को बताऊँ कि what you have to offer. So would you be just able to quickly introduce about yourself?
Okay, so I'm an orthopedic surgeon. I specialize in knee, shoulder, and hip surgeries. I have an experience of almost about 20 years. I started my career in orthopedics at Sion Hospital in 2001. Followed by which I started my practice in 2008 after multiple fellowships. I'm currently now practicing as a knee, shoulder, and hip surgeon in Beach Candy Hospital, Sekvi Hospital, and Hinduja Car Hospital.
Okay, so you're saying that you do visit Hinduja, then you do visit Safi, and you do visit Beach Candy Hospital.
That's correct.
Apart from that, is there any other place where we could get hold of you?
So I have my own clinic at Gamderi. It's called as the Oaks Clinic, and I'm here most of the days of the week.
Okay. So if you want, if someone wants to reach out to you, basically they need to. I believe you have a website, right? So
That's correct.
and that's correct. Okay. And you mentioned that you are. I mean, why do you specialize in hip, shoulders, and knee?
So orthopedics, basically, or in fact, all the medical specialties, if you see, they have sub-specialized into small niche segments. So I don't do any fracture treatments. I don't do any spine treatments. I don't offer any surgeries for the foot or ankle issues. What I do is arthroscopies of the knee, hip, and shoulder, and I do replacements of the hip, knee, and shoulder. So my practice is more elective, plan-based surgeries. And that is what is unique about the practice.
Okay. So for our guests, can you actually elaborate what do you mean by elective plant-based surgery?
So these are lifestyle surgeries. These are not life-saving surgeries. These are not emergency surgeries. These are surgeries to make the life of a patient better in terms of pain relief, in terms of ability to do things which they are not able to do because of the pain and difficulty moving the upper or lower limbs.
Okay. And what are the recent advancement in this sector so far? Is it like I mean, with the I think medical field, with time it usually advances. There are sometimes robotic surgeries. There are sometimes partial knee replacement. There are sometimes total surgery that is required. So can you just elaborate what exactly is the recent advancement that has happened?
So, as far as replacements are concerned, robotics has come into the picture in the last 3 or 4 years. We are doing a lot of robotic surgeries of the hip and the knee, and soon it's going to be followed by robotic shoulder replacements as well in the near future. Also, instead of total knee replacements, there's an advanced surgery which I've been doing since the last 15 years. That is partial knee replacements. Again, can be done conventionally as well as robotically. And, unfortunately, not many patients are aware about this surgery because there aren't many surgeons doing. So, in the world, there would be about 25% of surgeons who are doing a partial knee replacement surgery. So, the awareness is not there. But if you see in practice and in scientific literature, about 60 to 70% of patients do not require a total knee. They require a partial knee replacement. So when we do a podcast on partial knee replacement, we'll be talking in detail about it.
Sure, definitely. We would definitely have a separate section where we would be discussing about the different types of surgery. But doctor, if you could a slide as a surface level, if you can elaborate what exactly is partial and what exactly is total, if you're on a surface.
Yes. So can I just show
We are up in more energy on that. That would be really better.
So the knee is divided into three parts or three compartments that you'd like to call it.
Okay.
There's the inner compartment of the knee, which is about 33%. There is the outer compartment of the knee, which is about 33%. And there is the kneecap. That compartment is also 33%.
Okay.
Now, when we talk about a full knee replacement, we replace all the three compartments. We replace the ligaments as well. Okay. And we remove the menisci and everything. So the entire knee is a new knee. This is what a full knee replacement looks like after surgery. So we have removed all the three compartments. There are no ligaments anymore. And this is what the function the patient is going to get.
Okay.
Partial knee replacement, it is only the 33% of the knee which is replaced.
Got it.
So we are just changing the disease part.
Okay.
And you're just changing the surface of the disease part.
Okay.
So 33% of the knee is replaced, whereas 70% of the knee is normal.
Got it.
And we are not touching the ligaments at all. So it's more anatomical, more natural.
Okay.
Now, if 70% of your knee is normal, why would you want to go in for a total knee replacement surgery?
Okay, so as doctor has shown us, I assure you guys that there are going to be still more podcasts and we are going to deep dive more into these different types of surgery. But just to give you a surface level, doctor has explained it very well, and there would be some sort of following videos that you can watch. But tell me, doctor, basically, how exactly the life looks like after the surgery when any of the surgery takes place, be it the conventional surgery, be it the robotic surgeries. Just elaborate me a little bit more on that. How is the recovery phase?
So you're talking about a knee surgery.
Yes, correct.
So the knee surgery, whether it's a full knee replacement or a partial knee replacement, whether it is a conventional surgery or a robotic surgery, with the advancement in the medical field and the orthopedic field, most of the patients are quite comfortable in the evening after surgery. So our protocol is that we make the patient walk in the evening. So the surgery is done in the morning. Within about 8 hours, the patient starts walking and is discharged the next morning.
Okay.
Now we have a team of therapists working with us who have been trained by me, and we made certain protocols as to how do we go about customizing the rehab for each and every patient. So as soon as the patient reaches home, one of the therapists sees the patient, mobilizes and does physiotherapy for the patient, makes the patient walk. The next day, maybe take the patient down for a walk if they have a compound to walk in. And the third or the fourth day, they're so good that they actually come to the clinic and they do rehabilitation with us in the clinic, supervised by us.
Got it. So basically, you're saying that each and every patient has been is treated individually and differently.
And it's supposed to be that way.
Okay. So, doctor, a follow-up question that comes to my mind is, let's say, If you have seen a very famous movie, Munna Bhai MBBS,
That's right.
whereby Dr. Asthana, the role character was played by Dr. Boman Irani.
Yes.
He says that you cannot show compassion towards patient because if you do so, that on the surgery bed, your hands would shake, it would tremble.
Yes.
So how right is it, or you did it in some other way?
So, it is right to an extent when you're treating blood relatives. So, compassion towards the patient has to be there very much. Otherwise, I mean, the patient is not going to be happy, and you're not going to be a satisfied doctor. He was talking about not operating on your blood relative, because that is a time when you start doubting yourself. But luckily for me, fortunately or unfortunately, I would say that my daughter, when she was 5 years old, she had a fracture, and that time I used to do a lot of trauma surgeries as well. And I've operated on my daughter not once, but I've operated twice, because I felt that no other person would be able to give enough justice. Because I was a doctor, there's always a scare of another surgeon operating my patient, and I thought that I would be the best person to do it, and she's absolutely fine, touch wood. So I don't agree with what you just said. I mean, if you're confident about your skills and your skill sets and your knowledge, then you may even operate your own relative, if that is the case.
So, doctor, just walk me through how basically you actually plan a surgery. I mean, it definitely takes a lot of planning. It definitely takes a lot of strong mind power, willpower, because every patient is different. Every problem that they face is different. The human body itself is different. So, just walk me through it. Let's say I am a patient. If I'm coming and if I'm being diagnosed, let's say any disease that you feel like I've been contacted and I require surgery. So how would you deal in scenarios like me?
So, Shah, as I said, mentioned previously, whatever surgeries that I do, they are all elective surgeries. Any person is free not to get those surgeries done or can live with that pain. So, in the last 2 decades of my practice, I have never ever forced a patient, coaxed a patient to get a surgery done.
Okay.
I will always, kind of talk to the patient, advise the patient as to what is their treatment of choice. And if that treatment of choice is not acceptable to the patient, he may opt for an alternative conservative management. Uh, what is more important is that if any surgery, any planned or elective surgery is done on a patient who's not convinced or is not willing, no matter how good that surgery is done, that patient will never be happy. So it is very, very important that the patient himself is convinced that this surgery is going to help him, and only then we go for surgery. First and foremost, let me tell you, if a patient is coming to you with a diagnosis in mind, as soon as the patient enters my cabin, I tell them, please don't tell me your diagnosis, and I don't want to see your reports or your X-ray or your MRI. I want to listen to your story, because 99% of the times we get the diagnosis in the patient's story,
Okay.
or what we call as a history taking art, art which is forgotten by today's generation. Most of my times that I see a patient and talk to the patient himself comes out with a diagnosis for me to keep in mind. I don't see the reports, I don't see the investigations. I then examine my patient and confirm that diagnosis. And once I have confirmed the diagnosis on clinical examination, again an art which is very well forgotten by generation which is practicing now. Only then I have a look at the investigations to confirm, and then I sit and talk to the patient. Now, if you have an injury, or if you have a meniscus tear, or an ACL tear, or even an arthritis, or even a shoulder injury, if and only if your investigations are matching your symptoms, would I convince you for surgery, or would I explain to you? But if you have a tear in your meniscus, but you have no pain or no symptoms, I am not going to treat the investigations. I have to treat you. So take for example my situation. I'm an orthopedic surgeon who's doing a lot of arthroscopies and replacements. I have to bend forward, pick up heavy decks. If I go ahead today and do an MRI of my spine, there will be multiple disc prolapse.
Okay.
But that doesn't mean that I'm going to go and get a surgery done unless and until I have symptoms and signs which then relate to my investigation. Am I going to opt for surgery? Similarly, I treat all my patients that way. Secondly, I would do only those surgeries which I would do for my relatives. So if I feel that my mom Unfortunately, she's passed away. But if she had an issue, how would I tackle that? Is how I would tackle an old lady coming to me, or my brother, or my sister. I exactly look at my position and say, what would I do for my brother, or what would I do for my sister? That is exactly how I would treat my patients.
You just said that oftentimes the problem actually you are able to diagnose the problem when a patient is sharing his or her deathbed, correct? So let us assume that you have find the root cause, that you have find the problem, and there is some sort of supportive document that you require. I mean,
That's right.
yeah. In that case, what do you prefer? I mean, do you prefer the diagnostic reports that the patient has brought, or you prefer to you go it your way? And if you prefer to go it your way, why do you prefer that? Can you just elaborate?
Okay, so there are basic investigations which the patients can do, like bloods and X-rays. But there are specific investigations required, like specialized X-rays or MRIs, which I prefer that I get it done according to the the way and the protocols that we follow. The reason for that is that, as I mentioned, all specialties in medicine have become subspecialized. So if you go to an MRI center who's doing a MRI, say for an X amount of money, which is much cheaper than another center, there is a reason for that. The reason for that is that they're giving you less films, they are giving you inadequate report. So in radiology also, like in many other branches, you have an MRI expert for musculoskeletal disorders like knee, shoulder, and hip. You have a radiologist who reports only for abdomen. You have radiologists who report only for neurology.
Okay.
So if you're going to get your knee MRI reported and done by a specialist who's reporting for neuro, he would definitely miss out on many things which a musculoskeletal radiologist will not miss out.
Okay.
Unfortunately, there are only 3 or 4 musculoskeletal radiologists in our city in Mumbai,
Okay.
and I prefer to send the MRIs to them.
Okay.
Also, X-rays. There are specialized X-rays when we do partial knee replacement. Now, every diagnostic or X-ray center do not understand how to take those X-rays,
Okay.
and they come back with very badly imaged knees,
Okay.
which can then give us a false positive or a false negative answer. So in that case, it's better that those specialized X-rays are done at specialized places
No.
who know how to conduct those X-rays.
Yeah. So it's because for the patient's betterment, for the patient's care, it's always advised to be handled and taken care with the help of by the professionals as well.
Absolutely.
That makes sense. Doctor, for a common audience, you were discussing about the meniscus. Can you just explain what exactly that is? Why you were
Yes, sure. So let me just go back to the model.
Yeah, sure.
And if this is a knee model,
Okay.
now this is the thigh bone.
Okay.
And this is the leg bone.
Okay.
Now you see this blue surface over here?
Correct.
This is the cartilage.
Okay.
And you see the blue surface over here? This is the cartilage. The cartilage is the one which wears away when you get arthritis. Okay. You get arthritis because it's worn away. And to protect this cartilage, there are 2 shock absorbers in the knee, just called as the meniscus.
Okay.
Okay. So there are 2 compartments in and one compartment on top. So these 2 compartments have meniscus. These are shock absorbers which kind of take the load and protect this cartilage. Now in sports injuries or even layman when walking, running, if there is a sudden twisting of the foot,
Okay.
of the knee when the foot is planted, you would get a tear of your meniscus.
Okay.
And then it becomes unstable. So when you're walking, this will move with it and sometimes can get locked. Sometimes may give rise to clicking noises. Sometimes may give rise to pain.
Okay.
Yeah.
That makes sense. Doctor, you might have actually performed, basically, you have performed more than 5,000 per surgeons, I believe. So every time you, let's say, open a human body, you might be fascinated, right? How beautifully the human body is actually made up.
Absolutely, no question about it.
Okay, so what exactly means, as a normal human being, we usually tend to ignore our problems. We don't take care of our health.
Right.
But I would love to hear it from you. What exactly you feel that if there is a patient ignorance, what problem it could lead to?
See, with the advent of Google and YouTube and a lot of the social media, there's a lot of content which is being spread, which may not be true. and it is very, very important to verify that content. Now, for a lay person, if he's going to read something on a Google, it is good to read. Very, very good to read. Very, very good to listen to videos and watch YouTube. But they should not analyze it, because medicine is not 2 plus 2 equals 4. It's much more than that. For me to become an orthopedic surgeon, or rather, let me say it, for me to become a specialist in knee, shoulder, and hip surgery, it took me from my 12th standard, it took me 5 years from my MBBS, 1 year of government service, 3 years of residency, that's 9 years, 3 years of fellowship, that's 12 years. Okay. And if it took me 12 years and 20 years of practice to reach where I am, somebody reading Google or watching YouTube cannot reach that level by just reading or scrolling through videos. And it is very important that you read, but then you get your queries answered rather than analyzing yourself. So every patient is different. Every patient coming to me with a shoulder pain need not necessarily have a frozen shoulder. They could have a rotator cuff tear, they could have calcific tendinitis, they could have a instability, they could have a slap tear, they could have many, many things. So your shoulder pain is not equal to my shoulder pain. So it's very, very different.
Got it. That makes sense. So, doctor, let's say whosoever is actually watching this podcast, yes, and they might be either facing problem with regards to knee or with regards to hip or with regards to shoulder. So, where do you actually fall into picture? And let's say if our guests actually go ahead and they approach you,
That's right.
so how can you actually help them?
So, if they have a problem, I am not saying that they have to approach me. I'm doing this podcast to spread awareness, because there are like I said, there are orthopedic surgeons who are practicing general orthopedics, trauma, spine. They should be guided to go to the right person. I'm not the only knee, shoulder, and hip specialist in the city of Mumbai. There are many more like me. But if you have a problem specific to a particular joint, it is very important that that person goes to that particular doctor who's specializing in those things. What happens is that this avoids ghost surgeries. When I say ghost surgeries is, if you're going to an orthopedic surgeon who's not performing arthroscopy, and because you've been following up with him for the last couple of years, you like him very much, he suggests a surgery for you which he's not doing. He will call somebody else who does arthroscopy and get it done. Now, nothing is wrong in that. What is not correct is that person or that patient should be aware that who's the surgeon who's going to be operating him. So if your family orthopedic surgeon is introducing you to the right arthroscopic surgeon, you can request that your orthopedic surgeon be along with him to assist that surgery. But he has full right, the patient has a full right to know exactly who's operating on him and what is going to be the follow-up and the rehab protocol, because which is equally important like surgery.
Okay. So, doctor, usually, oftentimes there has been a misconception that most of the surgery is not performed in a good way. It could be again true, but if it's not performed in a good way, there could be a chances that maybe few years down the line you again require a repair surgery, a follow-up surgery, basically we call it as. So in that case, let's assume that if the surgery, I mean, what are the different factors that requires maybe multiple surgeries, or is there any way that the surgeries could again be limited for a longer period of time?
So let me tell you one thing, Shaz. No doctor, wherever he may be or wherever he's practicing or whatever his skill sets are, no doctor wants his patients to undergo a repeated surgery. They all try to do their best depending upon their capabilities and their skill sets. So nobody purposely tries to do a round surgery or cause a mishap. Complications happen. In my 20 years of my practice, I've had a few complications. If I say I'm not having any complications, I would be lying, or I'm not doing surgeries. So every doctor has a share of complications, and complications happen because of multifactorial reasons. The reasons could be iatrogenic injury caused, damage during the surgery. It could be related to the OT environment where you're getting operated. It could be related to the patient's immunity itself, whether he's diabetic or immunocompromised. All these things matter a lot as far as success of the surgery is concerned or not, apart from the skill sets of the surgeon. Now, if there is a repeat surgery which is required, it is very important to know what was the cause of the failure of the primary surgery.
Got it.
Once you know the cause, you can correct that cause, and your second surgery will not be a failure.
Okay. And doctor, usually, I mean, let's say any patient who has undergo even the primary surgery, can they live a very normal life, or is it like something that would be restricted?
So as far as sports injuries are concerned, most of my patients go back to playing sports, even recreational as well as professional. We've had badminton players, footballers who've gone back to playing their sports after shoulder and knee surgeries. As far as replacement surgeries are concerned, I've had patients who are 80, 82 undergoing partial knee replacements, and they've climbed up 3,000 steps for going to a native place or going to a temple. They've traveled abroad after the surgery. So yeah, you become as normal as you can be. Obviously, you're not going to become natural like God given, but it's going to be very, very close if it's done correctly.
Okay. Doctor, a small kind of an icebreaker thing over here. Oftentimes, uh, a lot of people they say ki the doctor was good, and some of the patients they don't even credit the doctor. So they are like कि जो भी हुआ ऊपर भगवान के ऊपर वजह से हो गया, जो भी हुआ ऊपर वाली का वजह से हुआ. So again, that's a good thing. But faith is one thing, but again, the professional, the experience, and the skill set also matter. So how do you deal with circumstances like this?
Luckily for me, all my patients do credit me for their surgery, but I don't take that credit because um, my job as a surgeon is to put the right thing at the right place. When I'm repairing and when I'm replacing, I'm putting the right implant at the right place. The healing of the entire surgery, the healing of the repair in a sports injuries is taking place by nature.
Go.
Nature has a very, very important role in healing of the patient after surgery. And the second most important thing is a positive attitude of the patient. That is very, very important. Positive attitude of the patient as well as the positive attitude of the doctor.
Doctor.
That helps a lot as far as the healing is concerned. So the confidence of the patient, the confidence of the doctor, the entire positivity around any disease, treatment of any disease or any injury is basically dependent about these factors. It's the nature, it's the positivity, it's the skill set, it's the right implants that we use to research.
Got it. Also, doctor, whenever let us assume that either of let's say even hip or a knee or a shoulder, let's say assume that you're performing any one of the surgery. Okay. So on an average, how much time? Let's say it's not that complex. It's a normal case. It's not that complicated.
Yeah.
So how much time usually it takes for one surgery to be done for?
So it is not just surgery, but it is also the entire process of taking the patient into operation theater, giving anesthesia, cleaning up the patient's limb, whether it's the upper limb or lower limb, painting, and then draping the patient in sterile, sheets. All those things also take a lot of time. But if you ask me, like for a partial knee replacement, what is the surgical time? That is my involvement in the surgery from, taking the incision to closure. It's about 45 minutes.
That's it.
Yes. But the entire process of taking the patient in the theater and getting the patient out would be roughly about 2.5 hours.
Complicated. Okay, doctor, if I may ask, what was one of the most remembered surgery that you have actually performed?
When I started my practice in 2008, I had a very, very complex surgery in which I had a person flown down from Nigeria who had come to Mumbai seeking my opinion. And I will show you the photographs of that patient with his knees. They were very, very crooked, about 45 degrees on one side, one knee, and 45 degrees on the other side, the other knee. It's called as a windswept deformity.
Okay.
And we performed the surgery for that patient, both the knees together. And the patient became absolutely all right. That it was such a rare surgery that Times of India actually covered it on its first, I remember, first or the second page. Oh, this is in 2008. That is something which I will never forget because that was the initial days of my practice. We made the patient walk immediately. Patient was very, very happy. It was my first year of private practice, and I have very fond memories of that patient.
Okay, so was there one of the surgery, or is there any other surgeries that is still in your mind?
So we operated a 98-year-old patient. 98-year-old. We did a single knee, total knee replacement for that patient. It was in 2013 or 14, I think. and it was the oldest patient to be operated for successfully for a total knee replacement surgery in India, and that was also fortunately covered in the editorial Times of India, and we inscribed my name in the Limca Book of Records for this surgery.
I was going to come about. I was going to come on that topic as well. So has anyone actually broken that top?
Not yet.
Not
Not
yet.
yet. Okay. Actually, the patient was not 98. He was a Second World War veteran.
Okay.
And he had he had fought the war for the British.
Okay.
He was not an Indian. His actual age was 104 when I operated him. But because at that time the passports were not made according to the birth certificates, and they made a passport for him at 98. But actually, he was 104 at that time. I was in touch with that patient for till very recently, about 7-8 years back, and he was doing absolutely wonderful.
Okay. So, doctor, in such cases, like say, how actually do you feel when there is a press release that covers your achievement? How do you see yourself? I mean, do you feel like okay, somewhere down the line I'm accomplished, somewhere down the line I'm on a right path? Do you feel?
Yes, I feel that I'm on the right path, and I'm able to, not just the press release, actually, every patient of mine who's happy walks out happy from my clinic. That gives me immense satisfaction and makes me happy that my parents will be very proud of me whenever they are right now.
Okay. Also, tell me something. Is there any other press articles that has been covered? Can you just talk a little bit on that?
There are many articles which came, but nothing really like these two which I mentioned. Recently, we did a robotic surgery for a patient, and the robot was just launched in India, launched in my hospital at Beach Candy, and that was covered by the press as well. And we did something for which is a biological implant for a rotator cuff tear.
Biological implant as in.
So it's a kind of a covering which is made up of bovine material.
Okay.
And it helps in healing the rotator cuff repairs much faster than they normally would. And in patients who have very thin quality of rotator cuff muscle and rotator cuff tendon, it actually helps in healing that much faster. And it was the first time that we had used it in South Mumbai, and that is why it was covered in the press.
But doctor, as you also mentioned about this surgeries, I just want to ask you one thing that can you just show me a difference between what exactly is a conventional surgery and what exactly is the robotic surgery?
So there's a big misconception about robots. I think we spoke about that earlier as well. Now, when we say robotic surgery as such, robotic surgeries are a part of general surgery, are a part of cancer surgeries, are a part of neurosurgeries, where the surgeon actually sits on the console outside the operating theater. And the robot is the one who's actually operating inside, and the surgeon is controlling the robot with the help of keyboards and joysticks. That is the actual robotic surgery. In orthopedics, it is not like that.
Okay.
It is more of a navigation tool which is there along with the surgeon. The data of the patient's knee or the hip is actually fed into the robot, and that robot makes a plan for the surgeon. And during the surgery, which the surgeon is performing inside the operation theater, this robot actually guides the surgeon so as that there is not much of there's a lot of precision. So there are a lot of degrees that we calculate. There are a lot of balancing that we do. So robot actually helps in that.
Got it.
Yeah.
That makes sense. So in both the ways, the surgeries that is either performed, it's safe to say that both are safe. It's not like one has the advantage, or is it like
I would say that I would not say that it's both surgeries are very good, but it's like this, Shaz, that if I don't know my basics, or if I don't know how to perform a surgery without a robot, I can make a lot of mistakes, even miss the robot, because the robot is only a guiding factor. Now, if the data fed in the robot is wrong, or there is some mismatch, or there is some error in the robot, and if I don't know and I can't pick it up, then I will be actually giving a much worse result than a conventional surgery.
Okay.
So it is a double-edged sword. For people who are experienced and have been doing replacement surgeries for quite a number of years and are practicing exclusively as joint replacement surgeons, for them a robot is an advantage, but not for everybody. not for the. So it's like like an open surgery and arthroscopic surgery. To do an arthroscopic surgery with a microscope, I should be aware about my anatomy, the open anatomy as well. Similarly, I have to know the basics of a joint replacement surgery. Only then will I give an added advantage of the robot to the patient.
For and doctor, I mean, a very specialized people or specialized doctors are maybe allowed to do the robotic surgeries, I believe.
Yes, you need a certification.
Okay, and you have the certificate,
Absolutely.
right?
Absolutely.
Okay, so basically, you are one of the trusted person when it comes to the robotic surgeries. Okay, got it. Doctor, most of the people or most of the surgeon, as you mentioned about the ghost surgery, I just want to discuss. Let's say they might just throw some buzzwords saying that this is going to be a robotic surgery, and maybe it cannot be a robotic surgery. So as a patient, what should they actually see into? How can they differentiate?
So where is this? The entire podcast is, I specifically wanted to pass this knowledge that it is very important that when you decide who's going to be your operating surgeon, you should do a full thorough check of the doctor as to whether he's actually practicing what he's, telling you or advising you. Whether he has how many number of surgeries is he doing in of that particular specialty, how many research papers has he published, and with the advent of social media and lot of Google searches, you can definitely find out whether what he's saying is actually holding true or not. So it is very important that before you decide whom to get operated by, you should have a thorough knowledge of what that surgeon is doing and what he's not doing, and only then you should go ahead and proceed with the surgery.
Okay, so you also mentioned about the research papers. You also mentioned that the doctor is conducting a talks or not. So just walk me through it. I mean, what are the research papers that you have actually published?
So we have published about 26 research papers in all international journals. We have a PubMed index. So these are journals which are of very high standards. And we have published a lot of literature, about 26 articles, which have been cited all over the world about 53 or 54 times.
Okay.
And we do a lot of innovations in surgery which we publish. We do a lot of analysis of our results which we publish, and it is more for academic satisfaction to to make sure that we are doing the right thing, and also for innovation. So it is very, I mean, I like doing it. It is very difficult to do that in private practice, but we make sure, me and my team, we make sure that we go ahead and publish at least two research papers a year.
Okay.
That's what we.
So you have made this as a habit that
Absolutely.
okay. And doctor, let's say someone who is watching this podcast outside of Mumbai or outside of Maharashtra, so and they do want to visit you. So and they maybe there is a possibility that they cannot travel. So is there, apart from Mumbai, is there any other place that you visit, or if it's like an affiliated hospital, if they invite you over, is it something?
So I have a lot of fellows whom I have trained. They are in different parts of Mumbai. They are in different parts of the country as well. I would definitely guide them to them. And if they want to see me, we can arrange for an online consult, and they can send me their reports. I can review them.
Okay.
Maybe talk to them on face-to-face basis with Zoom or whatever modality that is available, and we can definitely guide.
Okay, so as you are saying that, let's say by any chance, if any person, basically any person who is going through this problem, they are not able to visit you, you do offer an online consultation, and once you get a clear understanding what needs to be done, then if it requires surgery and if they cannot come to Mumbai,
Yes.
then you just provide them the restaurants.
Absolutely.
Go ahead, sir. Also, doctor, since you mentioned about the veteran, you also mentioned about the Nigerian guy. Tell me, because a lot of people, mostly the Korean society of India, they do prefer sometimes that it's better to go outside of India and get operated. So they compare themselves with the West. Let's say it's better to go into the West.
Yeah.
But I truly feel and believe that India is still well advanced in this medical field. So how do you take this? I mean, are we capable enough or are we not capable enough?
See, the reasons for them going abroad could be multifactorial. One could be they don't want to get expose them to the media. Celebrities, they don't want to be exposed in the media as far as surgeries are concerned. So as far as the skills are concerned, I think we are definitely up there. I can definitely vouch that our surgical skills and our technical skills and our medicinal skills are much better than that in the US. or any other Western countries. They have technology which we have readily adopted, and we have now better technology than many other Western countries as well. So, on a scale of if I have to decide where I want to get my own surgery done, it's definitely going to be India. Whichever branch it may be cardiac surgery or spine surgery or neurosurgery. I was in Canada for quite some time training, and I've seen over there that the waiting period is very, very long. To get a knee surgery done, there's a waiting period. When I was there in 2005, 2006, I think the waiting period was about 2 years. Now it's close to about 3.5 years. To get an MRI, is a waiting period of about 2.5 to 3 months.
It's that big.
Yes, it's that big. That is because it is served by NHS. So it's a government scheme, and they have to wait. And there's a lot of factors which make them wait. There are not that many doctors who are giving appointments and stuff like that. Besides that, also I would say insurance plays a big part in the Western countries. So insurance actually dictates what the doctor can do, what surgeries are allowed for that patient, what implants can that doctor use for that particular patient. So there are many factors which dictate what a doctor can do for the patient. Over here, it's my discretion as to if I want to do a meniscus repair and if I want to use 3 implants. I'm going to use 3 implants because that is best for my patient. But over there, I'll restrict it with the insurance. So then I can't do, and they cost a lot. So the patient may not be that willing to pay over there. In fact, recently I was discussing with you earlier. I have a brother who's in Chicago, and in 2021, I had visited, and my sister-in-law actually required full knee replacements as advised by the US doctors. And when I saw her, I convinced her that she did not require a total knee replacement, and what she required was a partial knee replacement. And they couldn't find a doctor who was doing partial knee replacement in Illinois, in Chicago. I had to actually organize from the company in India, which is a US-based company, of course, to find out who is the person who's regularly doing partial knee replacements. And we found one doctor, and then we got the surgery done through that doctor. She underwent a partial knee replacement for both her knees. It's been about 3 years, 4 years now, and she's doing absolutely wonderful. Now, hadn't I been there and I seen her, she would have gone a totally different done. So it's something which is very astonishing that a developed country like US, there are very few surgeons who offer this kind of treatment.
Okay. And doctor, what are the pre-symptoms? Like, say, since your sister might have a sister, I believe, right?
Sister-in-law.
Sister-in-law, sorry. So your sister-in-law might have, faced some symptoms, and based on that, you could have figured out ki, okay, this is something wrong with the knees.
Yeah.
Oftentimes, and this is what is required rather than the full.
That's right.
Yeah,
That's right. That's right.
so what are usually the symptoms of any of this? Let's be it knee surgery, be it the hip surgery, be it the shoulder surgery.
Yeah.
What are usual symptoms that one should focus on before actually visiting a doctor or a consultant?
So I would say it's the worst thing to visit doctors. Oh,
I was saying,
oh yes, I was here. Okay.
okay,
So I would, and I tell my patients, I think going to the doctors is the worst thing ever, because I've been through that in 1996, 97 when my dad was unwell and I visited many doctors. It's the worst thing, because first and foremost, there's a lot of trauma that you're going through the entire process. So if you can avoid going to a doctor, there are a lot of home remedies which one can do before actually visiting a specialist. And those remedies are very, very simple. It's called as the RICE therapy. Okay, it's rest, ice, compression, and elevation.
okay,
Okay, these are 4 things which you can very well manage at home. Once you do those things, and symptomatically you will start feeling better. You pull on till you actually require to go and see a specialist. So that is what my advice to all my patients is. I mean, my relatives, my friends. Because most of the doctors in today's day and age would see the reports and would advise surgery.
got it.
So it's not a very safe space, unfortunately.
And oftentimes, doctor, there is as you mentioned, there are Googles, there are other things, and oftentimes there has been cases, where there is a lot of information that is available, where there are a lot of professionals that are available. Each of the professionals are actually suggesting something. So one professional, as you said, the same thing with your sister-in-law. It was advised to go for a total knee replacement.
Yes.
Have you not been that she would have actually been for a total knee replacement? You were there, you advise. But oftentimes there are things like which are contradicting. Like say for example, there is a total knee replacement that needs to be done. That no, there is a partial knee replacement that needs to be done. And in the end, the patient is getting confused. So how the patient would make sure he is on the right track and the patient itself is not getting confused?
So I tell you, you go to, say for instance, and now I'm talking, out of the context, but please understand what I'm trying to tell you. If you go to a mobile shop and you ask for a laptop, would you get one?
No, unless and until you don't specify what exactly you need.
No, no, exactly. So now if you're going to a mobile shop and you ask for a laptop and the salesperson over there is going to tell you, but you can do all those things on the laptop which you can do on the mobile. You're going to get confused, right?
Correct.
Because this is much cheaper. You can do all the things on on a big mobile screen. You can read, you can surf, you can do all those things what you can do on a laptop. Uh, so it's similar. If you're going to a person who's not doing a particular surgery, but is doing another surgery similar to the one which you are doing, he's going to try and set you that surgery.
Okay.
So awareness comes when you actually know your disease. That is why I encourage my patients to read.
Okay.
I don't encourage them to analyze.
Correct.
So read, understand, see the options, and then take a call.
Okay. So walk me through your website, because I've seen your website. I've seen a lot of articles. So any patient who comes and visit your website, would you be able? I mean, would they be able to get a little bit understanding what you have to offer?
So I have actually, my website is completely, the entire content is written by me. So I have not Googled or ChatGPT anything. This website was made about 12, 13 years back or 14 years back. We have revamped it, but the content remains the same. It gives every explanation for every disease that I treat. And by just reading that website or reading that particular disease on that website, you will get a comprehensive understanding of what is the problem and what is the solution. And what are the other modalities of treatment.
Also. Okay, so doctor, usually everyone has their role model.
Yes.
So who was your role model? And why actually you chose to, go into hip knee, and why actually you chose to be an orthopedic surgeon and then deep dive more into shoulder knee replacement and
So I was my role model. I will come to that, but before that, why did I go into orthopedics? So I went into orthopedics because of one major reason was my dad.
okay.
So my father was having a lot of issues related to autoimmune problem, and he developed a fracture in his spine. And at that time, I'm talking about 1996, 97, and they were not, we went to the best doctors, the best hospitals. When I say best, I'm talking about experienced people who've done a lot of surgeries, who treated a lot of patients. And we struggled a lot, and that made me understand that this is something which a common man would feel, and that's why I chose orthopedics. I was actually going to become a spine surgeon.
Okay.
But over the course of my residency, I met my mentor, Dr. Thakkar, who's now retired, and he's my mentor, and he's my somebody who I really look up to and inspired by. And he's the one who encouraged me into going into this field of knee, shoulder, and hip.
Okay. And we were talking about medical tourism. So let's assume that any patient who's watching this podcast outside of India and they want to approach you.
Yes.
So what are the offerings that at least we can offer them with terms of the online consultation or a face-to-face consultation, the stay period, anything? So how do you handle guests, because you have a big team now? So how do you handle patients who are actually looking forward to come and visit India and get treated?
So first of all, coming to medical tourism, there are a lot of ways the medical tourism is working in India. Unfortunately, not all the ways are the good ways. There are a lot of these touts and ATMs which I've never encouraged in my practice over the last so many years. I would, and not just me, I would advise all people who are watching this podcast who are not even planning to come to me and planning to go somewhere else, please do. But do it in the right fashion. Go to the right person, go to the right hospital, okay? Go to the right doctor. We don't need middlemen who would drive the patients, charge exorbitant fees, and actually not delivered. If the patient wants a particular surgery done, now with the advent of Google and social media, this is very easy to find the right doctor, to find the right hospital. Contact the hospital if you don't want to contact the doctor. Contact the hospital. They will be the right people to advise, not the agents, not these companies, not these touts, because they fleece. And that is why I never encouraged any of that in my practice.
Okay. So, if anyone who's watching this podcast outside of India, so your advice would be directly to contact the hospital rather than contacting any of the medical agents.
Right.
Okay. And is there any way, let's say, sometimes even I've seen, it could be a possible thing that maybe in big hospital it doesn't happen in, but there are hospitals, smaller hospitals whereby within the hospital itself there are agents who actually just try to do something, try to take some more money or try to do some sort of barter thing. So is there any way through which you could understand, okay, this is some of the red flags in this particular hospital or in this particular person, it looks like something's fishy of that sort?
There are a lot of red flags actually. It's going to be difficult to enlist, and I don't want to, unnecessarily dive this conversation into something that we, shouldn't be talking about at this moment. But as I said, specialized surgeries need to be done at specialized hospitals, bigger hospitals, and with experienced doctors rather than going to any touts or agents. But coming to this topic, I would like to add on to one thing now. Uh, as I do arthroscopy, you're aware, I do a lot of shoulder arthroscopy, hip and knee. We do use a lot of disposable equipments or disposable instruments which we use during the surgery. Now, the hospital that I go to, that is Beach Candy and Saifi and Indusha, we do not reuse those disposables. Okay. The cost of those disposables is quite high, so it's a one-time use and throw. But there are many institutes and many surgeons who re-sterilize them and reuse.
Reuse.
Would you like a reusable, say, cannula, a small cannula or instrument, would go into your shoulder or your knee, which has already been gone into somebody else's shoulder, even though it is sterilized, properly sterilized? I wouldn't want that. So I want something which is only used for me and then thrown away.
Definitely.
The cost factor goes up quite a bit if you're using and throwing. Okay. But we as a policy and Beach Candy Hospital, we do not reuse any stuff, not even the blades which we use for cutting the cartilage during a knee replacement. It's a metal thing, but on the packet it's written a one-time use. So when it is a one-time use mentioned by the company, why would you want to reuse it again on another patient? So what these other hospitals and smaller nursing homes and they do is that they re-sterilize and reuse them, and that is why their cost is much lesser.
Their practical cost is
Yeah.
things.
So, but unfortunately, that one incident can cause infection, or that one incident can lead to complications, for which you will spend lakhs and lakhs of rupees. And just to avoid a little bit of increase in price by using the disposable, you're making your life very risky.
Okay. So, doctor, on an average, let's say these three types of surgeries,
Yes.
how much usually does it cost? A rough estimate, if you could provide, if there is anything, or maybe is it like the surgeries that are performed by you? I mean, does it get covered by the insurance, or does the patient needs to pay on top of it?
No, so we don't take anything on top from any patient. It is only through hospital billing, and it is completely covered by insurance.
So,
Now, every surgery or every hospital, the costing is different.
different. It's a
Me as a surgeon and my team, our charges are fixed.
okay.
Whether we get the surgery done in an economy ward or we get the surgery done in a deluxe ward or whatever. I am doing the surgery. For me, it really doesn't matter which ward you are in or which category do you belong to. For me, all the patients are equal, and for me, all the patients have equal charges. So just because you are rich, I'm not going to charge you more. Just because you can't afford my fees, yes, on some instances, of course, we do a lot of charitable work. We do a lot of free surgeries as well, but those are for the deserving patients.
Okay.
Uh, But as far as the costing is concerned, it's all fixed
Okay.
by the hospitals.
Okay, and can you walk me through this charitable trust, the surgeries that you do for the charities? I mean, are you associated with any of the charitable trusts? If someone is actually trying to,
So we at Beach Candy Hospital itself, we have a Godrej wing in which there's a lot of charitable work which is being done by the on-panel surgeons. I'm on panel at Beach Candy, so we do a lot of work which is completely free to the patients. Even if it's a knee replacement or a hip replacement or an arthroscopy of the shoulder, we do it completely free of charge. That money is being provided by a trust.
okay,
Okay. Apart from that, we are associated with a smaller hospital who charges very little, and we don't charge our fees so that the patient benefits out of that. So we are not attached to any trust, but we do it out of our own goodwill.
got it.
Yeah.
That makes sense. So, doctor, before we end this podcast, I'm pretty sure we have covered a lot of different topics. Yes, but since you are a doctor and there is a lot of viewers who are watching this podcast, as a doctor, one piece of advice or anything, a good message that you would like to share to our audience.
So my message to the audience is that you should go to a doctor who understands you, has compassion, is willing to listen to your problems, because half the problems of the patient can be resolved by just listening to them and then talking to them. Communication is a very, very important key, both from the patient's side as well as from the doctor's side. And also, all injuries or all pains do not require surgery. Before doing any kind of surgery, it is very, very important that you understand what you're going to go through and what are the options for you available besides surgery. That is very, very important.
Good. So by default, you should always have that window open, and you should always have that analytical mindset to think what are the trades of what exactly is there any other substitute that is available. Yes, and only then once you are confident enough, it requires a surgery. Only then you should.
Shad, I want to add something. I mean, if you live in Mumbai, right?
Correct.
Have you ever gone house hunting in Mumbai?
Our doctor, please. It's very difficult for me to find a house. It's very difficult, and I've been so.
How many houses have you seen before actually,
It's more than 10, doctor. It's more than 10 on it. It's more than 10.
So my message by this question is that you should at least visit 3 or 4 doctors of experience before planning to get any surgery done. Because you are right, and no doctor or relative or no personal friend should feel bad that you're doing that, because it is a right. You are handing over your knee or your shoulder or your hip, of you, even for that matter, any other organ of your body, to a particular doctor. You should have that much of faith in that doctor, and that faith will only come when you meet multiple doctors and realize who is honest and who is compassionate with you.
Good.
Every doctor is good, every doctor is skilled, but there is more to being good and being skilled.
God.
There's got to be a compassion, got to be a way in which a doctor treats you, and a way in which you see that you will be able to get better with this doctor, with his confidence and his skills.
That makes sense.
Yeah.
Thank you so much, doctor.
Yeah.
And guys, I hope that Dr. Amin has been able to deliver the message clear pretty well. And he was being quite patient. I was trying to, understand his mindset. I was trying to make it easy for you guys. So please watch this. If you have watched this video till this time, if you have watched the video till the end, thank you so much. Please subscribe. I would be mentioning Dr. Amin Rajani's contact details. If you want to go ahead and contact him, please feel free to do so. And I assure you guys that we are going to bring Dr. Amin Rajani back on the show again, because there is a lot of different topics that we need to discuss. It was just a surface level talk just to make you aware about what are the different types of offering that Dr. Amin Rajani has to offer. But what exactly he can offer you more in a better way on a particular thing, like say for shoulder or for knee or for, let's say, hip alone, they are going to have that. There is going to be several videos that we would be recording with Dr. Amin Rajani. So thank you so much. Stay tuned. Until then, stay blessed, and I will see you soon. Thank you.